Health Alert is brought to you by OU Physicians in Tulsa. Hello, welcome to Health Alert. I'm Pam Butler. Today I'm at OU Tulsa Schusterman, and joining me is the president of OU Tulsa, Dr. Gerald Clancy. Welcome to the program.
Good morning, Pam.
Now, we're going to talk about health care reform, and this is a really big area that many people are confused about, including me. Let's start off by telling our viewers what created this need for health care reform.
Well, it is a very complex subject, and I like to divide the reasons why health reform is important into four categories. The first is cost. The second is coverage, health insurance coverage. The third is clinicians. We're short on our number of clinicians. And the fourth is really the care quality that we deliver. So in a nutshell, cost of health care in America is really out of step compared to other developed countries across the world. We spend almost 17% of our gross domestic product on health care, and the next closest country, developed country, as far as how much they spend on health care, is about 12%. So that's a competitive disadvantage to American industry compared to what's happening in the rest of the world as far as health care coverage. The second is coverage, and we still have a huge number of hardworking U.S. citizens in jobs with families that don't have health care coverage, and the count right now is about 47 million Americans.
Right, and part of that gets back to what you were saying with cost. Even though you're in a job, there may be some degree of coverage available, it costs too much for you to access that coverage.
It really does. On their own, an individual trying to buy insurance is very, very expensive. It's much easier and much more cost effective if you're in a much bigger insurance pool where you can share costs with others. And so on your own it's very difficult to buy insurance. And one of the things we know is that individuals without health care coverage delay care, and when they delay care actually end up spending much more on treating those illnesses because you're treating them much farther down the line.
Okay, so the concept of prevention, which physicians really like to look into in the healthcare system, doesn't really happen in the system that we had going before healthcare reform.
No, we really, I mean, every emergency room physician, every one of our physicians in our clinics can tell you that on a daily basis they see the results of people delaying care, and they delay care because they don't have health care coverage and they're worried about the cost.
Okay.
And the number one reason for bankruptcy in America right now is health bills. People have an unfortunate health issue. They go and get care. The bill for that care is extremely high, and sometimes they end up in bankruptcy because of that. So this coverage issue is very real as far as a driver of increasing healthcare costs.
Okay.
The third area that we're not very well prepared for is the number of clinicians that we're going to need to provide health care to the United States.
Okay.
And there's several factors there. The first is that medical schools have not increased the graduating class size of physicians really significantly over the past 20 years.
Well, is that because there's not a pool of applicants that are qualified? Is that due to the cost of medical school? Is that a purposeful containment of providers to increase their worth?
It's really not a purposeful containment. The ability to predict what our healthcare workforce needs has been a complicated thing to do.
Okay.
And one of the mistakes of 15, 20 years ago was that health management organizations, HMOs, would really increase the efficiency of care, and maybe we didn't need as many physicians as we thought we did. That really didn't turn out to be true. So medical school classes didn't increase, so we didn't graduate more docs. The general population continues to increase 3 to 4% per year. The baby boomers are moving into a healthcare utilization category that is much greater. Many diseases that begin in their 50s and 60s, hypertension, diabetes, heart disease, many serious cancers start kicking in those 50s and 60s. And then people are actually living longer as well. So you've got the baby boomers, that's a big bump in healthcare demand, and you have the 80 to 90 to 100-year-olds that we're seeing many more people being able to live well into their 80s, 90s, and even 100, and obviously they need healthcare.
So with this clinician shortage, is it of primary care physicians, or is it of specialists? Is it of both? Is it look at beyond just physicians? Is it nurses and other people in that healthcare system? Is it the whole team kind of concept?
It's yes to all of those.
Okay.
We don't have enough primary care physicians across this country. We don't have enough specialists. One example I like to think of is this country is 24,000 child psychiatrists short
Oh my
across this country, which is
goodness.
incredible. It is cardiologists. As the baby boomers get older, heart disease kicks in. It is oncologists. We don't have enough oncologists to take care of the cancers that are kicking in for that population. We don't have enough general psychiatrists and neurologists to help with our growing number of individuals with Alzheimer's disease.
Wow.
So on the physician side, it's everybody.
Okay.
On the broader clinician side, yes, it's still nursing. Yes, it is physical therapy. Yes, it is physician assistants. Yes, it is nurse practitioners. And one of the, I imagine we'll talk about a little bit later, one of the solutions to that is physicians and nurses and social work and pharmacy and public health and ancillary services all working together as a team.
Okay. Okay.
And then the fourth issue is really care quality. This country offers some of the very best health care that you can get anywhere in the world.
Okay.
But on the other side of things, there are some individuals that the quality of care that is offered to them is not near as high as you. And so it's quite variable as far as quality of care. And if you look at the overall health of the American population, we're really not as good as we should be compared to how much we spend. So we're the highest spending country on how much we pay for health care. But our quality of care as a nation is really in the bottom third of developed countries.
And what people sometimes think, Dr. Clancy, is that if you have the money, you can get better quality.
Right.
And so that's what this is reflective and why we need this kind of reform, because it shouldn't matter how much money you have, the quality should be equal.
It should be there. And a great analogy is the airline industry. The airline industry has worked very hard over the past 25 years to improve quality and safety. And their track record is really strong. It really is. And healthcare can do the same thing. We can push healthcare quality and safety to a greater degree than we have in the past.
Okay, well, what we're going to do is take a really quick break and then come back and get into some details of this healthcare reform bill, because I'll tell them a secret right now. You read the whole bill. So we'll stay put, and you're going to tell us everything that's in it. Okay, please stay put. We'll be right back.